A very warm welcome to another exciting edition of your favorite program, Health Affair on AIT. On the program, we'll focus on critical health challenges, issues of women and children, with a view to finding lasting solutions. I'm your regular anchor, Ushuomowa Daniels. Cesarean section, also known as C-section or cesarean delivery, is a surgical procedure by which a baby is delivered through an incision in the mother's abdomen. On the program today, we shall be telling you all you need to know about CS and why some people object to it. As usual, we'll start the program by taking you through the news segment.
The World Health Organization, WHO, has listed Sinopharm COVID-19 vaccine for emergency use, giving the green light for the vaccine to be rolled out globally. The Sinopharm vaccine is produced by Beijing Bio Institute of Biological Products Co. Limited, subsidiary of China National Biotech Group. WHO's emergency use listing is a prerequisite for COVAX facility vaccine supply to import and administer COVID-19 vaccines. The emergency use listing assesses the quality, safety, and efficacy of COVID-19 vaccines, as well as risk management plans and pragmatic suitability, such as cold chain requirements.
From the basic points of care, which involve the three elements of the patient, the healthcare worker, and care of treatment involving contact with patients and surroundings, the hands are indeed critical components of disease transmission.
About 50% of infections are transmitted through the hands. So when you wash your hands properly, you break that chain of transmission. So in washing hands, first and foremost, you wash your hands. You can wash with soap and water if there's running water, or if your hands are visibly soiled. But if your hands are not visibly soiled, you can use the alcohol hand rub, what we commonly call hand sanitizer. And when your hands are dry, your hands are safe and lives are protected.
With the COVID-19 pandemic, the theme for the 2021 celebration, Seconds Save Lives, Wash Your Hands, for some speakers here, could not have come at a better time.
As a hospital, we treated over 900 patients and COVID-19, over 900 COVID-19 patients, and over 14,000 samples are taken in lieu. And it couldn't have been possible without training in the infection disease unit and other. But infection prevention and control training gave our staff the confidence to combat the disease. Basic as hygiene is, it was and it is also very important contribution to stemming the dangerous tide of COVID-19 in Lagos State, particularly, and Nigeria in general.
For mothers to teach their children and their colleagues to wash their hands. That is the take-home. Awareness. Because whatever you know, she knows, and we all know. That way we can spread the message.
The Save Lives Clean Your Hands global campaign was launched in 2009 and celebrated annually on 5th May. It aims to maintain global promotion, visibility, and sustainability of hand hygiene in healthcare and to bring people together in support of hand hygiene improvement around the world.
Lagos State government has embarked on a total overhaul of infrastructure across all levels of its health care delivery system. The Commissioner for Health, Professor Akin Abayomi, made this known at a ministerial press briefing organized to mark the second-year anniversary of Governor Babajide Sanwo-Olu in office. While noting that the promotion and protection of the health of residents of Lagos State has a positive impact on social development. Abayomi said the state has planned ahead for a possible outbreak of COVID-19 third wave.
Have a better understanding of how to manage COVID, although COVID is changing, and I dare say you can still call it COVID-19 if you want, but a better name for it is COVID-21, because COVID does not stand still. With everybody it infects, it changes its genomic structure. And that is why you're reading about all these mutations in Brazil, in India, in South Africa, in the UK, and even here in Africa, we're seeing mutations. And so the virus is not static. and therefore we cannot be static. We need to keep tracking it. We need to keep understanding it. We need to keep following how it is changing, and so that it doesn't catch us flat-footed.
Referring to COVID-19 as now COVID-21 due to mutation of different strains, the commissioner said the state has deployed the eco-telemedicine strategies to monitor inbound travelers with appropriate sanctions for defaulters.
We are about to roll out the same thing in Lagos State. We are going to monitor inbound travelers to make sure that they are isolating according to the guidelines and that they come for their day 7 test. The federal government has recently announced some new guidelines, which I will explain shortly. But suffice to say that we're going to use eco-telemed to monitor. We have search teams. If they can't find you where you say you're supposed to be, the search teams will come and locate you. One thing that's happening is people are giving us wrong information on their health forms. We're going to stop that process through technology and through sanctions.
So Abayomi also called for continued adherence to the non-pharmaceutical intervention that can also help curb the spread of tuberculosis and other communicable diseases. From Wuhan in China to the rest of the world, Nigeria recorded its first COVID-19 case on the 28th of February 2020. Though the Italian index case survived the coronavirus, that signaled the beginning of a new way of life, the use of nose mask, the lockdown that left the streets of many cities, especially Lagos State, empty, the death toll, and several other lessons experts here say must not be allowed to pass without shaping governance and individual way of life.
The lesson certainly not lost for me personally, and certainly not lost for my government. I know that indeed what COVID has brought forward to us, the truth, though, that the structure of our governance system are the kind of things that we want to look into and change. If it is to say that the cost of governance is heavier.
This is a learning process. You know, the pandemic is still on, but we've got to learn a lot, not only about viruses, but about how people respond to them. So there are a lot of lessons from this documentary about the actual response, about our level of preparedness, about how humans behave when we're faced with an existential threat.
The need to revive the primary healthcare system in preparation for other infectious diseases resonated amongst the discussants.
We need to bring in capital to ensure that those hospitals that are then consolidated, they are larger, they are well-resourced. We need to ensure that they are also well-equipped.
Expansion of the National Health Insurance Scheme and capacity building in terms of personnel were also suggested at the forum that had as its theme leadership, trust, and the COVID-19 pandemic. Welcome back. Doctors consider a cesarean section for many reasons, which include when a woman carrying a pregnancy is living with certain chronic health conditions like heart disease, high blood pressure, gestational diabetes, and other factors that put the mother and child at risk. When the babies are many, like twins, triplets, quadruplets, and more. When babies come with abnormal positioning. When there is prolonged labor. When the low-lying placenta partially or completely covers the cervix, commonly known as placenta previa. The reasons for doctor considering CS could go on and bothers majorly on the safety of mother and child. So why then do some people resist it, even when it seems beneficial? Sir, what do you understand by CS? And would you want your wife to have a baby, your relation, maybe your sister to have a baby through CS? If yes, why? If no, why?
It depends for me to say yes or no. But for what I've observed over the years in Nigeria, especially in the private hospitals all over Nigeria, when you see doctors or hospitals, requesting that you do CS, believe it that it's majorly for pecuniary reasons. And I have many of them, I'm saying doctors, hospital owners, I have many of them as friends, and I've raised this matter, and some of them have spitefully confessed that it's true. You see doctors preaching, even at the early stages of pregnancy, preaching what you call elective surgery, trying to remodulate the mind of the expectant mother that this is not your first, or if you say this is your first, they know how to talk you to say, the moment is 8 months, you don't have to wait in the 9 months, just get rid of it, don't pass through any pain. So you see techniques, they work on people, ladies' minds. Some of our people, capitalize on this to make money. The average CS cost in Nigeria now, especially in Lagos, is 300. Some collect as high as 400, 500.
Have you had this CS?
Yes, I have.
What was the experience like?
Wow. It's not really as easy as people have been saying that doing CS is just better than going through the normal delivery section. Though mine wasn't an implication, or just because I had a big baby and I said I would stress myself pushing. So that was why I was referred to go through the path. So the pains, it's also there. It's painful. And after that, the normal one, when you go through the normal delivery, they press your tummy, and then within a few months, your tummy is flattened, it's gone back to its usual, its normal size. But this one, I think CS makes one tummy, it makes it bigger than the usual. So that's one of the disadvantages, which I don't like CS. But it now depends on your eating habits and getting fit for you to be back in shape. I wouldn't say this is the best. Both are best because both of them is better. So it depends on the mood or the person's choice. Let me put it that way. The person's choice, and if the person is not fit to push, or if there are complications, why not go for CS and don't waste the baby you carry for 9 months, and at the end you say you want to force yourself to go through. And I know it's expensive, but they have the months, the 1 year period for you to plan. The 9 months year period for you and your husband to plan to gather money in case if this comes.
I prefer to go through the labor pain than the CS.
Why?
Because the thing is, how will I put it now? Life, there's no assurance of life. Life cannot be, you can't say, okay, if I go through that CS, I'm going to survive. So why go through that extra pain, using extra money? I prefer to go through the normal process, through the process that has already been designed by God, than going through CS.
I spoke with a consultant gynecologist on this topical issue. He's Dr. Benjamin Oluwatosin Oluwojebutu.
You have two kinds of delivery for children. Either is spontaneous vertex delivery, SVD, or a cesarean section. What are the causes of cesarean section? People need to know that when the baby's head is bigger than the pelvic, that means cephalopelvic disproportion. You have a big baby, and the opening to come out is smaller. That means the big baby cannot come out from that small space. It's called CPD. That means the cephalic is the head of the baby is bigger than the pelvic. So you have to do surgical, because if you try to force out the baby might die. So we call it long, very long, prolonged labor. Labor is long. When labor is long, the fetal out of the baby begins to drop. Baby can die. So those are indications for surgery. So when normally placenta should come before the baby. When you have placenta leading the baby in the uterus, we call it placenta previa. At that point, you cannot have that baby because placenta will come out before the baby. Baby will bleed to death. So what we need to do, and the mother can also bleed to death. So what we need to do is to go surgically into the womb, take out the baby and take out the placenta. So sometimes you also have fetal distress. It can cause from anything. Maybe you have gestational diabetes, the woman is diabetes, or you have the gestational hypertension, the woman is hypertensive, and that has what we call eclampsia. You see women fitting you see them fitting when they're pregnant. At that point, to save the life of the mother and the baby, is to do what we call emergency cesarean section. There are so many wrong sayings in Nigeria or in Africa about people saying they don't want to do surgery, they don't want to do CS, and it affects increased maternal mortality. The mother dies, the baby dies. What have I advocated now is to have spiritual people, you have pastors, the imams, also understand clearly what these things are. It's not a cause to do surgery. It's not a bad thing to do surgery. The right thing is to educate the patient, or educate your people, your audience, your church members, your mosque members, that no, when the doctor says you need to do surgery, it's because there's a particular challenge, and that's what you need to save your life and life of your baby. You shouldn't carry a baby for 9 months and want to lose the baby. It's wrong. It's not nice. There's always an indication for cesarean section. Ask the doctors always for what is this, what is the indication. Then go for the surgery. God is always available. God will help you. You come through the surgery and you're going to be okay. You'll be alive. Your baby will be alive. That's very, very important for us. So I advise all the spiritual people in Nigeria to please educate their members that it's not a cost to do surgery. No. There are indications to do surgery, and it's important for the woman to be alive and the baby also to be alive. That's our advocacy now. So we can reduce maternal mortality.
So is it that the babies born through surgery, they are not normal babies? What differentiates them from the one that they deliver through
Nothing differentiates. They are beautiful baby. Nothing differentiates them. It's just the only difference is just the pattern of delivery. That's all. Babies are normal. They are great babies. SVD babies, CS babies, they are the same thing. The only thing that differentiates is just the path of coming out. Nothing is different. They are absolutely the same thing. Nothing happens to them. Implications for refusing help, surgical help, CS help when you need to do it. A lot of it. Cerebral palsy, cephalohematoma, fetal death, maternal death, which means you've pushed baby enough. The baby's skull is trying to come out of that small pelvic. You push, it damages the brain. It damages the nerves. They have cerebral palsy. And it increases blood in their brain. They have what we call cephalohematoma, which means there's not brain injury in their brain because you force them. It's like forcing them out of the pelvic rim because they cannot come out of it. So when you labor for a long time, more than 12 hours, 14 hours, and it's prolonged labor, you reduce the ability of the baby to come out easily, and the baby begin to feel weak. When the baby feels too weak, is a point to go for surgery. And when you don't go for that surgery, baby can die. Can I shock you, ma? Some people will still say that they don't want to do surgery. Now, after they've tried, they don't rupture their uterus. Are you getting me? By the time you have ruptured uterus, it's important when uterus is ruptured, you must do surgery. Because for uterine rupture, at that particular point, that baby is dead. The woman will also die if you don't suture the uterus again. So it's important we stop people from not allowing. When you need to do surgery, it's simple. Pray to God about it. God will give the doctors the wisdom, and your baby will be fine. You also will be fine. There is nothing wrong with doing CS. The absolute indication for doing CS. And please, when your doctor says you need to do CS, just pray and go for the CS so you can keep your baby and yourself alive.
Could it be because of the pain? Before now, you do CS, it takes a long while, the woman can...
No, it's not the pain, it's just a lot of people lack information, that's all. It's not about the pain. People just lack information. They listen to the wrong people, they listen to the wrong advice. So because your grandmother had babies normally, you must also have baby normally. No, that's not the truth. What is important is that your baby is fine and alive. That's what we're trying to advocate now, please.
Before now, they'll say, before now, I saw my mother had the CS.
Good.
It takes a long time for them to recover and all that. For those who don't know that,
times have changed. People recover very, very quickly now. I do CS and they're ready in 3 days. They've gone home. They're okay. It's just education. People are getting better. They're faster recovery. I've seen a woman that got pregnant again after 6 months after CS. They're well again, So it's about understanding, eating right, eating balanced diet, doing well, doing your exercises, following your doctor's instructions, and you're going to be okay. There's nothing wrong in doing CS, please.
And how many times is it safe for a woman to go through CS?
People say 4. 4 is fine. 4 is fine. 4 is a good time. At least after 4, the womb is not as weak as before again. 4 times you can only say as 4 times. Support your wife. Making children is a family matter. It's your wife and yourself. Please, the most important people in your making decision is you and your wife, not your pastors, not your imams. If both of you can agree on the right thing to do for your family, that's very. Please, husband, support your wife to make the right decision. Wife, listen to your husband to make the right decision, so we can keep our babies alive and reduce maternal mortality.
Thank you very much for coming on the program.
Thank you very much.
Appreciate you.
Thank you.
If you're just joining us, it's Health Affair on AIT. Now let's take you to our nutrition segment, an aspect of the show where we'll bring you different fruits and food items and their nutritional value. Beans are the seeds of one of the several genera of flowery plant family, Fabaceae, which are used as vegetables for human or animal food. They can be cooked in many different ways, including boiling, frying, and baking. Beans are used in several traditional dishes throughout the world. They are mature forms of legume seeds, a simple dry fruit which is contained within a pod and comes in different varieties. Beans are a summer crop that needs warm temperature to grow and matures between 55 to 60 days from planting to harvest. Beans are one of the earliest cultivated plants, with proof of cultivation and being used as food dated back to about 9,000 years ago. It was domesticated in Thailand, although African countries like Nigeria and Tanzania are also part of the world's largest producers of beans. They were known to ancient Egypt as they were left as food in the tombs of dead kings to be eaten in the afterlife. Beans was also known as the food given to Daniel when he lived in captivity for 70 years at Babylon in ancient Assyria in 605 BC. Beans are valued worldwide as a sustainable and inexpensive meat alternative and are considered as the second most important food source after cereal. They are nutritionally valuable as 100-gram serving provides 347 calories of energy, 42% of protein with essential amino acids, 64% carbohydrates, including dietary fiber. They have no cholesterol and are generally low in fat, which is about 1%. Beans also provide essential minerals and vitamins like potassium, 39%, magnesium, 44%, iron, 28%, calcium, 11%, vitamin B6, also known as folate, 25%, and 10% vitamin C. Beans contain some bioactive compounds like flavonoids, polyphenols, among others, which possess antioxidant properties and play major roles in the prevention of certain cancers, heart diseases, rheumatism, osteoporosis, and other degenerative diseases. I'm sure you don't want to miss out on our clinical segment. It provides you the opportunity to get vital health tips and diagnosis without the stress of going to the hospital to see a doctor.
The Pharmaceutical Society of Nigeria and the appropriate government agency, that's the Pharmacists Council of Nigeria, continue and will continue to insist that in pharmaceutical premises where you have this conventional green cross emblem, usually they put PSN numbers on those green cross emblems now, so that you can know that it's from the only umbrella template of practicing pharmacists in Nigeria. That's the Pharmaceutical Society of Nigeria. Please look out for this sign, because these are places where the Pharmaceutical Society of Nigeria and the Pharmacists Council of Nigeria certifies and assures you that you can get genuine medicines at all times.
Next on the show is our Perception segment, a platform where your opinion counts on how to shape the nation's health sector for the best.
I hope they will not look at you and say, Barrister Daramola, you are Can General Secretary, come and take your own. And leave that, my brother, in the village for not giving. I hope criteria will not be drawn up by saying you are entitled for the first arrival or for first consignment, and we wait, ad infinitum for the others to come. We should take it very necessary and very seriously when we are discussing the availability of vaccine, if it is so important that we should take it.
This is where we'll wrap up the show today. Please join us same time next week for another exciting edition of the program. My name is Lsmoh Daniels. Please cultivate the habit of regular health check to detect any problem in good time. It makes solution easier. Keep safe.